right. We've been talking about our company a little bit and various parts and pieces to it. And I think we've mentioned the word advisor. So we're going to, people ask us, well, what do you mean advisor? What's an NPI advisor?
Normally, you would log onto our website and you'd click the link that says client survey, and you would share with us the answers to 50 or 60 questions about your practice. Services, amenities, technologies, your office hours, just a boatload of questions that you can easily answer. And that information comes to one of our advisors. Our advisors are responsible for building the appropriate marketing plan after they diagnose the market area and they diagnose the data that you give us on your client survey. Mm-hmm. Your client survey is going to tell us how marketable you are. Mm-hmm. That's important for the advisor to know as they compare that against your market. Is your market incredibly competitive? Is it marginally competitive? Is there an open space? Is there a zip code over here that nobody's paying attention to? There's a whole science behind how we build marketing plans. But your advisor is responsible for building a marketing plan within your budget that reduces the risk to your marketing dollar the most.
Right.
Okay, so now that may seem unimportant. It's actually the most important. Whenever you apply marketing dollars to anything, Howie, when you and I look at our marketing budget for next year, right? Mm-hmm. What do we most want? We most want to apply our money where it's least risky.
Exactly.
Right?
Yeah.
So our company is exactly the same as what you should be doing. Right?
Okay. We don't want to take risks that we don't have to.
Right.
Shouldn't.
Yeah, we don't want to do that, right, with our marketing budget, and neither should you.
Exactly.
Okay, so your advisor looks at how marketable you are, looks at all the analysis data that we gather for your market area, combines the two, looks at our company history of statistics. Over the last 25 years, we have risk analysis statistics on every marketing medium. Internal, 3 different kinds of mail, every form of print media, radio, television, the internet, everything that you could possibly think of to promote dentistry. We have a risk analysis of it. So the advisor aligns that up, pulls out the least risky items that are going to be able to be deployed within your budget, and they package it up in a Microsoft Word document in a form of a marketing plan with sections. And the sections are logically separated areas so that when they get on the phone with you to discuss your plan, it all makes sense. We don't send plans out that don't make logical sense after you talk to your advisor. So then the advisor emails that off to you. They print and snail mail one to you. It'll probably come 5 days after you get it in the email. And then they schedule a call. So they get on the phone with you and they'll ask you to open up your plan. And they're going to go section by section and explain to you everything they found out about your own marketability, about your market area, what your budget should be. Here's what we would do with your budget if it were our practice. Why? At what volumes? Who are we targeting? How often? All the details. Here's what it's going to cost to produce all these things that we're going to put on the street. And here's your budget. Okay, and our advisors, nobody at NPI, another thing you'll enjoy about our advisors is they don't sell people. I know dentists get hammered and they just get hammered.
Yep.
By sales, professionals that sell them a marketing plan. We've never sold a marketing plan. Ever. If our job is to make sure you understand the research, science, and logic behind what your marketing plan should be, should you decide to have us deploy it. If you don't want to, you don't have to. We're not going to chase you. Just tell us. You decided to do something else.
Okay.
We're
good with that.
We're good. We're fine. If you choose us, then your advisor is still responsible for the outcome because your advisor calculated what the ROI, what what our numbers tell us the ROI should be if you deploy all these things. Our numbers tell us how long it should take you to gain that ROI. Your advisor is going to share all that with you, which is really useful before you go into marketing to know what to expect.
Yeah.
And we'll be within 10 or 15% of what that advisor tells you. We almost always are. Okay. So, and then you just make a choice. Do you want NPI to be your marketing firm or don't you? And then if you do, the advisor then hands the entire plan over to, we have a robust customer service department. Their job is to implement the entire plan. And in most of our plans, there's 50, 80, 90 mission critical, little tiny date oriented details that have to happen in order to get everything to go off smoothly and efficiently and effectively. And that's what our customer service department does.
Right. Actually, what we do is a lot like what you do. First of all, you have to examine the patient, then you have to prepare a diagnosis, and then you have to prepare a treatment plan. That's within the patient's budget.
Right.
That's what we do too.
It's the same thing.